So sadly, I am not John Krasinski here to report some good news. I'm here to report some sad and very bad news. Now, as COVID-19 doesn't appear to be slowing down anytime soon, people are taking this opportunity and time to show their support and admiration for healthcare workers, from doctors, nurses, to paramedics, to even non-healthcare workers such as grocery store workers, showing their support whether it's through social media, random acts of kindness of giving them free food, and even starting GoFundMes to help raise money to buy them supplies. Even people going outside their balcony windows of apartment complexes and clapping and praising them.
Thank you to everybody who is out there helping us.
However, this sadly isn't the case for some other countries such as Mexico, India, and Australia, in which rather than receiving unanimous support and praise, they're receiving backlash instead. Some doctors and nurses are receiving verbal and at times physical abuse and discrimination and segregation. In order to dive in deep into this topic, I'm going to be discussing this topic into 3 parts of the video. The first part I'll be discussing the attacks and victims and the reasoning as to why people are attacking nurses and doctors, and the second part I'll be discussing the response that government officials and healthcare workers have. Third, it'll be a bit of a heavier topic. In this topic, I'll be discussing self-harm and suicide and the toll that this has on doctors, nurses, and any healthcare worker. Whenever you do reach that part of the video, if you feel uncomfortable, I'll be showing you a timestamp right here on the screen as to when to skip. But for now, let's discuss the first topic. Now, I will be looking down my phone a lot to look at my notes and to quote things that doctors and nurses have said in interviews. So let's start off with Mexico. In a CNN interview, Dr.Lorna Breen was walking her dogs on a street near her house when suddenly a person screamed behind her and doused her in a chemical mixture. Her eyes and neck began to burn until she realized that the chemical was bleach. She states that at first I was in shock. Then a week later, she stated to CNN, then I felt scared and angry. Now this not only happened to her, but also 21 more victims that were nurses and doctors as well. Now those were the reported victims. There have been other victims that have stated their attacks through social media, but haven't filed a lawsuit or a claim or report yet. In India, in a Washington Post interview, a psychiatrist by the name Sanjibani Pangirai, I apologize if I butchered the name, who works in a government hospital, found her apartment complex neighbors turning against her. One woman shouting, "We are sure you have corona," and others shouting that they didn't want to let her in. In New South Wales in Australia, in an interview with ABC News Australia, a pregnant midwife who was going in the drive-thru at McDonald's began to show her ID to the employees so she could receive a free coffee. Now, as she was doing this, the customer right behind her began shouting to her that she shouldn't be spreading the virus. And more severe or equally violent as the Mexican attacks, or the attacks in Mexico, nurses have claimed that in hospitals they're being spat on by impatient patients, the irony, who are waiting for their COVID-19 screening. As for the reasoning as to why people are attacking doctors and nurses, a small minority of people believe that doctors and nurses are helping spread the coronavirus. That since they're working with patients, they themselves are getting infected and spreading it to more people. To go about it in this way of just physically assaulting and verbally abusing them and segregating from their own home is just so childish and immature, irrational, any kind of insult that you can really say, because what gives you the reason to do this? Instead, you should be giving them support and giving them supplies. In Mexico, even before the whole pandemic happened of corona, hospitals were already having a shortage of medical supplies, from masks to gloves to scrubs. They were having a shortage. And now, because the pandemic is happening and they're having more patients and having to constantly change their scrubs, they're having less and less materials. And because of this, some managers told their nurses that they could only wear masks and gloves in certain parts of the hospital in which it wasn't too populated or had many patients that were COVID positive. Now, some nurses came forward and stating that even in a room that was full of COVID positive patients, they were told not to wear masks and gear in order to save materials. What the fuck? That's insane. But it's truly insane. You are attacking medical workers who are trying their best, risking their lives to help aid people back to health and to find a cure. Why are you attacking them? Why are you making their lives so much harder than it actually is? It's childish. It's beyond childish. Even children wouldn't act like this. This is terrible. This is brutal. This is a mob mentality and misinformation. You're just going about it such a wrong way. The doctors and nurses aren't getting infected because they want to. They're doing this because it's their job and because they chose to do this and because they chose to save other people's lives. They're trying their best in order to prevent themselves from getting infected, but since they're surrounded with people who are COVID positive, they can't help but some of them actually get infected. It's not their fault. They're trying their best. And then you're going to attack and berate them for trying to save people's lives? What the hell? Also, why are you out and about in public attacking doctors and nurses who you claim to be COVID positive and getting so close to them? Shouldn't you be as far away from them as possible? Why are you taking so much time and effort and grabbing bleach and to spray them on their face? What do you gain from this? What is the outcome? What is the goal? That doesn't stop anything. That's not stopping corona from increasing. In Mexico, the current state of COVID patients that are COVID positive is over 14,000. And I think 3,000 have been cured, but there have been 1,000 deaths, which is tragic and sad. But you can't put all the blame on doctors and nurses. Stay at home, wash your hands, 6 feet apart, people, come on. Now let's begin to segue into the responses that government officials have stated to nurses and doctors and to the public. As for Mexico, nurses and doctors were told not to wear their scrubs outside of work due to the risk of being violently attacked by citizens who claim that they are infected with COVID-19. It's ludicrous and truly insane, and now doctors and nurses can't be proud of the uniform that they wear. It's tragic. Also Mexico, Fabiana Cepeda, who is the head nurse of the Mexican National Health System, also known as IMSS, was at a press conference and discussed the issue at hand. Now, I'll be leaving a link to the video in the description. It's 10 minutes long, and it's all in Spanish, so if you want to go check it out. But to summarize it for you who don't speak Spanish and want an English translation of it, in one portion of the video, Senora Cepeda states that she's worn her uniform for over 27 years, and her coworkers, nurses and doctors, are very proud of wearing that uniform, but now, due to the pandemic and showing the ugliness of people and how they're so violent towards medical workers, now she can't be as proud of wearing it out in public, because if she does, she'll be attacked or berated or verbally abused. In another portion, she mentions that not only are these verbal and physical attacks against medical workers an attack against them, but also an attack against the unification of Mexican people. There are worse things to focus on, which is the virus itself. Attacking one another is not going to help anyone or unifying them. Instead, we should work together as one on combating this virus and supporting and uplifting one another. In another part, she almost breaks down in tears. She says that we are humans as well. We have lives, we have families, we have people to take care of. We are just like you. We are people, and we shouldn't be receiving this much discrimination and violence towards us. We are human beings. And near the end of the video, she tells the viewers and audiences who are watching this conference from home, saying that if you want us to help you, help take care of us, because all we want to do is help you and take care of you. And you never know, the person that you are berating and attacking could be the exact same person who saves your life. And she's right throughout the entirety of the video. She has a gigantic point. If you want nurses and doctors to help save you or to help aid you, don't attack them. Do the right precautions. In the video, she also states that if you don't want to catch COVID-19, which is pretty easy, just stay at home, stay 6 feet apart, wash your hands, use hand sanitizer, do every safe precautionary measure that you can. It's not that difficult. It really isn't. When you go out and about, this is me talking me now. If you go out and about attacking people, getting as close as you can to attack them, you're doing the exact opposite. What do you gain from this? This is post-editing, Alberto, and I forgot to mention that Mexico has also ordered soldiers to be stationed outside of hospitals in order to protect nurses and doctors from ever being attacked. Now, in India, in response to Sajibani Pangirari being segregated from her own apartment complex, police officials and government officials have intervened and have helped her and protected her going home. And then her apartment complex neighbors stated that they were sorry because they were just in fear of hearing this whole pandemic go down. It took government officials and police officers to help get the point across to people who are being insane. And as for Australia, Health Minister Brad Hazzard, Police Commissioner Mick Fuller, and Police Minister David Elliott have not only encouraged doctors and nurses to come forward about their attackers and to expose them, but will also publicly shame them on Facebook, and if the attacker is found guilty, will be charged the $5,000 fine. This is a fantastic way of going about it. You expose the crappy, shitty people who are attacking nurses and doctors for doing their job and to helping people. You are publicly shaming them with good reason. People like this deserve to be shamed and humiliated. They have no right. Once you spit on doctors and nurses and any person for no reason, they have this crazy theory that they're helping spread the virus, is ludicrous. You deserve to be shamed and publicly humiliated because of the sick person that you are. It's so inhumane and illogical, and I'm so glad they are doing this, and hopefully doctors and nurses in Australia and around the world who are being attacked come forward and file police reports and publicly shame these attackers, because you have lost every respect once you spit on someone who is doing their job and helping people. Now let's segue into the heavy weight and toll that this has on healthcare workers. In New South Wales again, but in a different article, healthcare workers and junior doctors who are living with their parents are actually now looking for small apartments to temporarily stay until the corona situation passes. They're doing this due to fear of infecting their immune deficient parents. One example is Dr. Ian Lang, who moved in with his parents back in December after being away for a couple years. Once news of corona began to rise and grow, he moved out of his parents' house and found his own apartment complex due to fear of him accidentally contracting it and accidentally infecting his mother, who is a diabetic. A lot of junior doctors and nurses are doing this, and it's much harder for them because it's hard to find a small apartment complex that they can afford on their budget, and many of them are reaching out to fellow workers and doctors to find apartment complexes or anywhere that they could live in if it's with other people. Now onto a much more heavier topic. As I mentioned, this segment will be discussing suicide and self-harm, so if you don't feel comfortable, click off this video or skip to this timestamp in which I discuss my conclusion and final thoughts. Sadly, the world has lost two brave and courageous healthcare workers and just two human beings who are courageous and caring and brave overall. The first I want to discuss is Dr. Lorna Breen, who is a medical director of New York's Presbyterian Allen's Hospital. She was first sent on a week and a half of leave due to her accidentally contracting the virus, but after she came back from work, the doctors in the hospital told her that she wasn't ready yet, as well as her family, who intervened and told her that they needed to move away. So they took her on a vacation to Charlottesville, Virginia, that she could stay in until she was mentally prepared and emotionally prepared to go back to work. Because her father had stated, as well as other doctors, that she was working tirelessly and working so many hours. 12 hours is a normal shift for doctors. It's a lot, but due to corona and the pandemic that's going on, it's much more stressful and you're having a lot of patients. Her father had stated that all she wanted to do was help patients. Now at one point, she felt very impatient and that she wasn't accomplishing anything because there were patients waiting in ambulances and in waiting rooms to be cured or to be tested and be receiving the right medication. After staying in Charlottesville, Virginia for a little while, her family had discovered that she had self-harmed herself and committed suicide. They had taken her to the hospital, but due to the self-inflicting injuries, it was already too late. Her father had then said that she tried to do her job and it killed her. She was a hard-working doctor who wanted to help and save people, but due to the stress and high volume of many patients, it just took a toll on her emotional and mental stability. Another person who had fallen victim to this craziness and crisis of the pandemic and just having an emotional and mental weakness to the deaths and stress that they've experienced throughout this is John Mandello, who is a 23-year-old EMT who, after graduating in early February, from FDMY Training Academy, he was stationed in Claremont, which is already pre-pandemic, is a high call volume area. And so to have it already being a high call volume area and then mix the coronavirus, it became extremely stressful to his mental and emotional stability. One of his friends said that he didn't like his new job and it seemed very stressful and was giving him a lot of anxiety. Another friend by the name Al Javier had stated that Mandello had told him he experienced a lot of anxiety witnessing a lot of death and had failed to save a life. And many of his friends and family had stated that he was a very preppy, happy, outgoing person. After working as an EMT for 3 months, John Mandello had taken his life with the use of a gun that he had taken from his father, who used to be an NYPD police officer. It's tragic to hear this news. It's tragic to hear people being overwhelmed and stressed due to this coronavirus. We as citizens should be praising and helping and listening and talking to doctors and nurses. They're having a terrible and rough time and high anxiety inducing experience at the moment. They're having a high call volume. They're trying their best to help as many people as they can. They're working endlessly and tirelessly as possible, and they just need a person to talk to or just some comfort and some light in their life. So please, do not verbally or physically assault your nurses and doctors. They're human beings. They're trying their best to help people. All they want to do is save a person's life and to help them. Please do not make it more stressful for them. I encourage you to please show love and support, even if it's not verbally or physically doing anything that shows support towards them. Even if you just stay at home and not going out is already enough support. You're helping by not exposing yourself to this virus and potentially getting infected and possibly getting them infected if you go to the hospital. Do your best, show your support, create a GoFundMe, It's post-editing Alberto again. I just want to quickly mention that Dr. Lorna's family have actually created a fundraiser in memory of her, bringing awareness to the mental health and supporting for mental health of doctors, nurses, and any kind of health, bringing awareness to the mental health of doctors, nurses, paramedics, and every healthcare worker. So if you want to check it out and donate, I'll leave the link in the description below. Give them a hug, well, not a hug, but show your love through social media and make a post about it. Do everything you can to show some support or love towards these doctors, EMTs, and healthcare workers, and grocery store workers, any kind of worker who's out there working their job during this crisis. Show them some love and support through social media, through random acts of kindness, whichever way possible that you can. So please, stay at home, stay 6 feet apart, and stay safe. Thank you guys for watching. Hopefully it's very informative review. Hopefully have a new perspective on things. And just have a great day and stay safe. See ya.